that, we will go ahead and get started with our presentation. You can sit, stand, do whatever you're comfortable.
Okay, installing the PowerPoint. Did you see that? I think it's a bunch of, can you find it?
Yeah.
Okay.
Is there any audio on it at all?
No, just, but there is some of the link that I would like to show. So, again, my name is Amelia Nanton, and thank you so much inviting me here, and it's such an honor to meet all these wonderful ladies from healthcare background. Actually, I'm not healthcare background, so, and, but I've been in emergency several times, so I know my experience very well. So, can you go to the next slides, please? Yes, I would like to talk about just 3 areas I would like to touch, especially I don't have a 15-minute, I will leave it 5 minutes if you have any questions.
If you run a little bit over, it's fine, because there's plenty of time for questions afterwards.
Sure. And I'm originally from Burma. I came to the United States since 1995, and I graduated from IU. After that, my graduate study from Indiana Wesleyan University, and I'm doing my pursuing my PhD from Indiana Tech, and also I'm teaching there as well. Again, as I mentioned that I was an executive director for the Burmese Advocacy Center. Some of you probably already know, which is organization is dealing with right now. I was with them over 8 years and working for the immigrant and refugee who resettled here in Northeast Indiana. So I would like to talk about a Burmese American in Northeast Indiana and some of their health issue and their preventive care and education. Those areas, I think, based on my experience, and I thought this is, based on my experience also, 2 days ago I spoke with the registered nurse, and which is, she have an 8-year experience working at the public hospitals, and she's a now nurse practitioner. She's an Asian American, Burmese Asian American. So I spoke with her 1.5 hours. If there's her, she can share some of her experiences. In fact, I will leave it some of Burmese American physician names, and there is several nurses that's probably can help for that down the road if you need to. Any of healthcare provider want to talk to them, that would be great. I think they can express more than I can do. But here I would like to talk about the population and some of the issue and preventive care. Could you go to the next slide, please? So, if you can see that, I pulled out those numbers from the website, from Wiki. So yeah, and in the United States, and we have 223,000 Burmese American living in the whole United States. But Indiana, we have over 40,000 living in Indiana States. But unfortunately, there is no accurate data, but especially in Fort Wayne, Indiana. So when I look at it, when I search, I see that there's 30,000 in Indianapolis. But in here, according to the last census, which is only we have 8,000. I don't think that is accurate, because if we have 8,000 families, that could be possible, because we have a large family, as you know, but 8,000 individuals is not right, because at least we have 20,000. If you can look at it, Fort Wayne Visit website, and there is some of their data mentioned that 25,000 Burmese American are living in Northeast Indiana. So which number you want to count, that is up to you, but I know that I came from the nonprofit background, I understand that how important the numbers are, because that's how we need a resource to provide these people. So can you go next slide, please? So the reason is that why 8,000 are inaccurate, and because we are diverse ourselves, I'm sure all of you are already aware how diverse we are. We have 135 ethnic groups living in Burma. So if you can see that this Burma, Shankayin, Yakai, Rohingya, Kachin, Mon, Korean, and Wat, and there are majority of ethnic groups. For example, Chins, they have another 30, 40 sub-tribes. So underneath them. So that's why if you're asking, because when we did, I was involved in census as well, because I did mention that, but unfortunately the lack of education and communication, and it was tough to reach out. If you go to ask to Chin, you're Burmese, you're gonna say, I'm not Burmese, but that number is down. If you're gonna ask Korean, are you Burmese? No, I'm not Burmese. So because all those numbers go to the racial, other population. So that's, I think that is partially the reason that we didn't have accurate numbers. I hope that one of the organization can look at it more, that would be great, we can get it more, the correct numbers. But here in the Northeast Indianas, we have a majority group are living in here, for in Northeast Indiana is Burmese, Korean, Kayin or Korean, however they want to pronounce, and Mon, Chin, Burmese Muslim, Burmese Chinese, and other multiracial as well. So we have, at least my number, I think there is 15,000 to 20,000 between there, because we all knew that, because Southeast area alone, there is its entire population is taken over, and we know that. There's at least 8,000 already there, I think more than 8,000 there. So, if you want, one day, because usually when I was with the Burmese Advocacy Center, with a lot of different university, different organizations, I have a chance to meet, and I bring them to the town and tour them around the town. So there's the mosques, the temple, churches, and they need to understand the different, our diverse cultures. We are ourselves, how diverse the difference is. It's not just only our racial differences, also the language as well. The language difference, religions belief is a difference as well. So that's why providers should reach out their religions leaders, their community leaders, and that could help if we want to have an accurate number. So, and this is the health issue. Then I look at it. This is from the ACHEC Gov, which is Office of Minority Health. This is a 2018 statistics, which is diabetes are one of the major issue that not just only Burmese American, overall Asians as well. So can you clip this link, please? 11.4% is overall United States, which is a quite number. Can you do that? Any good? Okay. There. Can you close that? Thank you. I'm sure that, and all of you are aware, these data, and especially I would like to show a little bit of how these numbers, if you can see that Asian American are 40% most likely to diagnose with the diabetes, and especially non-Hispanic white population. So that is the primary health issue because of the food that we've been eating, because the lack of education. I think that the lack of education, because when you come to the environment, the differences. So most of the Southeast Asia countries are extremely hot compared with our weather. But the food we eat over there, especially rice. So when we come here and we continue to eat the same food, which is not appropriate with this weather and this environment. So that probably there's, again, I am not physician, I'm not health background, but according to the nurses that I spoke with, that is one of the reasons how the rice can cause. Because it's not that we eat rice a little bowl, we eat an entire bowl, an entire plate. And 3 days a week, every 3 times a day and every day. That is a major issue. But I don't think any of, if I'm wrong, I don't think that there's educational a system that approach them to aware how the differences can cause their long-term health. I think that is part of the reason. Another thing is over there, we use the public transportation a lot because it doesn't matter how much rice you eat, how much oil you eat, actually we need it, how much sour or salty that we eat because we need it because of the weather, the environment. Here, and we eat it mostly bland, our foods are bland because of the environment that we live. So that is a different, I think there's a gap, I see that, because the knowledge. Oh, could you go back to the slide, please? Another one is mental health. This is from I think from the website. Mental health problem. So when I was in the Burmese Advocacy Center, I did mention that how important mental health for these, not just only Burmese Asian community, I mean Burmese community or entire Asian community, especially people who have a limited education and limited knowledge. You come into the different country, and then especially in the refugee community, probably you said that they have a traumatized when they live in refugee camps already. Because as you know, Burma alone, we have a civil war over 40 years or 50 years. And a lot of immigrants, Burmese immigrants and refugees, they grow up in the refugee camps. The problem is, I'm sure there is some of the educational program. I don't think this is enough them to digest themselves, to understand, to able to fit in a new environment. So basically, I think they might change it. I'm not sure. I've been away from the nonprofit for a while. They come in here, they have like a 30-day, 90 days, and then after that you have to go to work. How are we going to learn a different education system, different healthcare system, different legal system, different cultural environment, and different language, and especially different weather? How are we going to learn it within 3 months and 90 days? Then you have to start working, you have to start adjust yourself. That's alone. And whether people realize that some people are strong and they can adapt it very easily, some are not. But especially like people who came in such age. Because when they're younger age, yes, they can adapt it and very easily the culture, but especially the elderly are still struggling. That alone, beyond what is traumatized in Burma and political issue, the war issue, the safety issues, and here alone, that is, I think we have to pay a little attention. I think that would be great. So that's why I think the mental health issues a lot of just lately become, I see the numbers, and also the nurse that I spoke with, she mentioned that. And so that is something that if healthcare provider, if you can look at it. Another one is the lack of communication, which is people cannot communicate if they don't understand the language, if they don't understand the system. Even we understood the system because we can still communicate sometime with our healthcare provider or insurance, especially insurance, and or physicians, because even sometimes we don't know what is going on in our body. So it's difficult to describe, especially people who cannot speak, or there's people who can only speak a little language, that can cost more. So I think we need more medical translators, and it doesn't mean that people who can speak English, they can translate it because of the terminology differences. Even they can speak English if they don't speak Burmese, or different dialects. I'm not talking about just only Burmese community, I mean overall. So, and then they have to have more resources in those areas to train appropriate medical translator. Then they can help the physician, the nurse, or anyone. So another one is the healthcare system. This is based on my experience. We have a family doctor. We have to go see all the different specialists, and we have different issues. I'm sure all of you can speak, all of you know healthcare system very well. Even if we can speak, we are frustrated because each one of the physicians you're going to see, you can have a 15-20 minutes. there's a limited time and a limited resources to seeing this patient. So I'm not blaming any one, but it is important that the physician provide enough time to the patient, listen, understand their problem. Because I didn't have, at least what happened was, if we didn't have enough knowledge what is going on with our health, the first thing happened is something happened, we want an ER. Second, I want an ER most of the time because I'm worried about what is going on with me. This is my experience alone. If you can put it out, the people who just come in didn't have any of the knowledge, any of the system, and they just, how much damage there physically, emotionally. So that is something that I believe that, and we can work on. The cultural differences, it's cross-culture. Even our community alone, when I speak with the Chin community, Hmong community, Korean community, I have to look at it, their cultural differences. And that is another area that if the healthcare system provides a cross-cultural education for healthcare provider, I think that would help for the long-term effective communication. So that is something that I think after I spoke with her, based on my experience and based on our community needs, I think that is a very important, preventive care education. So why do we have to wait till we find it out we already have a cancer? I mean, that is what I see. We don't have enough preventive care. So yes, there is a website, people who have enough knowledge of computer, and you can go search and look at it. But no one have time to sit in and 1 hour, 2 hours, sit down and search in all these symptoms. Even you understand the language. So I think people who cannot speak, and that be the words. So I would like to end it up. The question is, are we gonna wait or are we gonna take in care? But so definitely, I think we need more resources to come to the Northeast Indiana, provide this kind of services, this kind of need to the, all the populations. So thank you so much for having me. If you have a question, I can stay like 5 minutes, then I can leave.
Any questions out in Zoom land? Anything in the chat? Any questions in the room?
Yeah. Can you explain the cultural differences of a Burmese family, probably in my situation, focusing on men, what their interaction with a female provider would look like and how that would be better navigated? I have more female providers in my practice than I have men, and if they're seeing Burmese men, how would that best look?
Well, first of all, most men, they don't want to come to clinic until they have such critical conditions.
Yeah.
That is overall men, I believe. But mostly they are very shy with the female provider. This is the experience I'm speaking of my husband. So, anything happen, he have to wait till the last minute to go to the clinic to check out. So, and sometimes it's not just only the individual behavior, it's also the religion's purpose as well, because they don't like to, it's not just only men, it's a woman as well, because some religions is, it's not appropriate to like men examine women, especially if it's OBGY. So it should be woman physician is more appropriate. But when it's come to the critical condition, it doesn't matter man or male or female, because they need immediate medical attentions. But usually men, they don't want to go. They don't want to go, and usually they just take some of at home and some of the traditional medication. That is another thing. I wish I have time to talk about that, but that is most of the immigrant and refugee community, because instead of going to the clinic, a regular checkup, and what they do is they just use a traditional medication at home. So, but beyond that, there's just, I don't know. So, yeah, but I hope that I can answer your question.
And I think what she's asking, similar to what I'm gonna ask too as well, being the president of a neighborhood association, and I'm actually southeast off of Oxford and Anthony there, so I have a lot of Burmese in my community, and that is one of the things that I've been, not just with health, but just trying to find a way to communicate. They say go to the temple, but going to the temple and trying to build those relationships is somewhat difficult. And you have any, because me as a Black female going into the temple, saying I want to meet with who this, I have a couple of your ambassadors, but they're not over all of the whole Burmese community. You have different cultures, and with that, with you acknowledging this and speaking on this is very, very brave and informative for you to do so, but it is a very complex problem that we're all dealing with. And I think as we continue to approach what is the better good for the communities, because the transition was so fast, there was no way to prepare. There was no way for a neighborhood association. There's no way for the agencies. And then with the cultural differences, how do we approach that? Because we can't approach the woman is not as allowed to speak. And then if you have someone like me, that I've been in law enforcement, I'm very direct, I'm very authority oriented. I'm the oldest, and when I come in, I'm coming in to mean business. I'm not here to play. And so it is a very conflicting space for the community even try to embrace that, because even when you do it, they shy away and you try to contend. You have one of the young Burma, I met with her, and it's a very complex thing to even try to approach and try to meet and mingle. I try to, greet, I keep my distance, and it's a very complex things to do. And I know that the city has not done a very good job of welcoming those changes. And the people that's really on the ground is really upfront with it are being ignored. And so I don't know what we're gonna do, but I appreciate your courage, your transparency, and sharing all of the obstacles that we have to look at. Thank you so much for your presentation.
Thank you. Appreciate it.
Yeah, thank you for that feedback. I do want to contribute to that a little bit. I recently had a conversation with some members of the Indiana Minority Health Coalition, and we talked about trying to get community health workers certified and trained and identify some trusted individuals in the Burmese community that can participate in the community health workers like Peggy and Lupita and Nia and Cassius, so we can have someone working at Health Visions and in the community that can relate to their culture, that can help kind of be that bridge, that you can go to, and maybe they can go with you to that meeting in the community and help with that introduction. And
I mean, yeah, I've actually been able to, they agree that they're gonna do, and then when you come back for them, then that momentum is no longer there.
They kind of backed out.
They kind of backed down, yes.
Yeah.
It would be tough, even our community, for example, if I go to church, just walking in, even people warmly welcome, because it takes time to be part of the club.
Yes.
It's a part of the group. It's going to be tougher, especially there is the lack of communication, and because the Western and Eastern culture is
totally
quite
different.
So I think that's why I mentioned that cross-cultural communication, diverse training, and for the healthcare provider, not just only healthcare, other providers as well.
Yeah.
I'm sure there's education. I mean, when it started, 10, 15 years ago, and every agency have a problem. So, and then we have done our job for a while.
Yeah.
But again, it's human being. This problem is continue.
Yeah.
It is important that who you reach out. And again, as I mentioned that before, there is tons of Burmese American nurses, and in the Lutheran Hospital, Purdue Hospital, they've been working, I know them. And then several doctors, physicians here as well, in the PUFU, in the IU, and then also Lutheran hospitals there. I think those professionals could help, especially in this health area. So, and
But
when
even
you
if-
reach out to the right person, and you can get a direct direction.
And I think
to
when
where
you was
need it.
talking about the losing services, even before it gets to a health issue, it would be nice for us to help build some more rapport, because by the time you get to a health issue, then everybody's afraid and no one knows how to trust or do anything because their loved one is at a very vulnerable state. So we just have so much work to do in reference to how we're going to approach this real transitional change all at once, because there's so many dynamics to it. Because even before the Burmese people got here, the same things that you're dealing with, we're dealing with the same things. And we're United States citizens, so
Right.
collaborating from the physicians to dealing with this and what we need to do as American citizens, we've been dealing with some of the same issues. So I think collectively, we really need to find a way to bridge, because even when I receive something that I need to share with the citizens as a neighborhood president, the city just sends it to me in English. And everyone over in my community, I have all nationalities in my community. So when they send it to me, they know this from the census. So they need to send it in all different languages, not just, and I've been working with them on this. I'm hoping, I just seen something that they sent from Public Works, talking about the trash and the bulk, and they had English, Spanish, and Burmese, but it wasn't all of the Burmese languages. So, you know, it's just so much work that we have to do. So, like I said, I appreciate you busting this wide open for us to see a big picture of what you're dealing with in reference to the culture and what we've been really fighting for every day. So we still got this health vision is real big.
Yeah, it is. You have something to say?
I think for approach this problem is needed a lot of money and more work opportunity for Burmese community in the agencies. I think part of the health problem with diabetes is because it's not only the food, it's the stress they have for the previous trauma they come before make it to United States. And when they make it to United States, we add discrimination, lack of opportunities, they get minor jobs, more stress because the money they get working is not enough to cover all the needs they have. The jobs they get normally are, I don't know if you know, but many of them just work even not on town, in not 40 miles distance in these farms where their day is killing chickens all day, and that's not a nice job. Because the conditions they are in these farms for even killing the chickens, these guys and these women and having even nightmares for what the job is through.
Yeah.
So then, and just to give you a little example, my husband is an attorney in the community, and he was taking clients from Amani, Burmese clients, most of them women victims of domestic violence, and he stopped to taking cases from Amani because they were providing the interpreters. Something happened in Amani, there's not interpreters now, and he's stuck with all these clients that don't have money to pay for interpreters, and they are on their own now, and he cannot even communicate with them. I try to find like someone that were bilingual in Burmese willing to help him to take care of these women, and I'm talking about already he even was charging $400 for a divorce that lasts 2 years because the Burmese husband normally fights a lot and for everything, and they are the ones that work. And it's just, they cannot get the service they deserve, like a human being, a victim of domestic violence, just because there's not interpreters available, and the few there are, they charge you $150 for the first hour and a half, and they don't go to work in court for less than that money. And really, the problem is a huge problem. When we were working on Whittington, providing services for DCS, we have a Burmese family and they have done anything bad. Their child got burned with ladle while she went to open the door, and a little bit of the soup fell over him. She told the husband, they go to Sanyo Hospital. They explained everything through the interpreter by phone that even was not speaking the same dialect than they had. She tries to, she started just to making up the conversation. So then the doctor, and finding the burn, that is why she and the husband took the child over there, and they have different information for the interpreter, and they make a call to DCS and they take the child. So then when DCS starts giving them services, they say, we don't want more interpreters. We will deal in this with our English. And I, with my English and their English, we did a good deal for have the case resolved, but I needed to even explain them with mimic what exactly happened to the child before I were coming back to DCS and make my report, and then they give them the children back, the child back. And then they keep them 3 months on services for I could teach them their whereabouts in the community.
So the dialects are definitely a big barrier, because in each of those dialects, just the slightest difference can change the word that you're saying.
The
So
English language is just like one word
the
has
English
10 different
language is the
definitions.
most
It's
complicated.
the most complicated.
Yeah, I know, and has so many different meanings. And so if, you know, in that example, she's saying the ladle of
She was saying the spoon, and then
Right.
they were saying, for her, you know, the ladle, it was like the spoon. So then, when I made through the mimic that in their home, they were explaining everything to me, she showed me, I say, oh, now I understand, because these were saying, well, a spoon don't gonna cause this, that, it was a ladle.
ladle, right? And so, I mean, in that situation though, this family literally had their child removed from them, had to go through the entire processing
Yeah.
system with the child welfare system to get their child back because of a simple language barrier and misinterpretation.
Exactly.
One of the questions that I had, kind of going back to, like different, like traditional healthcare treatments within the Burmese culture, are there any specific, like Burmese traditions that are cultural, like treatments that would be used in the home versus what's out there in Western medicine that maybe could be helpful to integrate into Western medicine, like cupping or things like that?
That's a good question, but for me, I mean, I'm growing up here, so, which is, I don't use any of Burmese tradition, but I'm not sure the other, how much they are using. I'm talking about like a tradition medicine that they can get at a convenience store or grocery store. That some of the minor cases that they've been using it. So I don't know that is how much effective, how much helping them, or how much dangerous with the side effects. But that is, I'm not sure. But I knew that, and a lot of them were using it because that is how we were. Because in Burma, when you live in jungle, when you live in a refugee camp, and a lot of them didn't have the healthcare system providing like we have here. I know we still have a problem, but it's compared over there and here is quite different.
Yeah.
So, and they are used to it, they treat themselves, and when you have a stomach ache, when you get a headache, and they just use it in the traditional medicine that they've been using. But there's another thing I would like to add. Yes, of course, there is knowing the system and also knowing your right and your responsibilities are also important too. Because everything is not a blame into the system. Sometimes how you can adjust, how you can adapt. So that is important. To be able to understand that concept, it is important how we have enough knowledge that we give it to them or give it ourselves. What I'm talking about is not just, it's a two different things. There is a patient and there is a provider. So these two, that's why it's cross-cultural communication is important. that how we can communicate, how we're gonna understand, before they come to ER, they come to see the physicians, they use any medication before they come here. Even the translator, can understand some of the word. The problem is some of the medication they've been using, probably she might not, or he might not. So that is understand entirely.
Yeah.
So, we can go each detailed stories, but the overall is, and right, what you said, we need enough resources coming to here, then provide those medical translators, provide the education, preventive care trainings, any of them. It's both sides, clients and also providers, so that could help,
Yeah.
so.
And I think going back to what Diane said earlier is just about that, our population grew so fast here that it's hard to keep up with those needs. The needs, and if the numbers that you spoke of earlier are accurate, there's way more of a need here than what, we have the capacity to meet. And, that's where we have to start building up within the community, within the Burmese community, getting community health workers trained, providing that education so they can be a resource to us and within the community.
And I think that is the biggest barrier right now.
Mm-hmm.
And I know I'm right in the middle of it.
Mm-hmm.
And it is a very difficult task, even trying to build a relationships. You're going back, they're polite, and we work on some things, but I have to blame the welcome wagon that brought all of this to play. They did not do, it's just a whole domino effect of misinterpreting and not being able to be effective. In my position, it is very frustrating because in my position as a president, I have to deal with all of these. This is not a paid job. I don't get paid for anything that I do every day. So in this situation, trying to reach out and be of good and to be a welcome wagon and to connect, it's hard to do that when the resistance is there from the beginning. It's constant resistance. And why are you being resistant? And I'm right here in front of you is where we really need to work on it. Regardless of the cultural differences, you're in a different environment, and we really, for the ones that's really trying to do the work, they wind up receiving energy from the people that really gonna halfway do the job, and the one that's trying to do the job, we don't have time for it. And it's just so confusing and manipulating that we're not getting anywhere. Yeah. And we need to have real conversations, not these puffed up conversations to make things sound good and look good on paper. I'm just sick of it, and that's just me. And I don't mean to trigger anything in here, but no, I know we got a lot of lives to save, and we keep fluffing conversations instead of dealing with the issues. And that's just it.
I think that brings a good point.
Comment online, somebody wanted to say.
Okay, you want to read that?
Go ahead. Okay, she want to come off mute.
Oh, okay.
Hi, yeah, thank you so much, Cassius. Yeah, so this is to Diane's point, and really it's for the whole group, but I just wanted to remind people or let you know if you don't already know that the Center for Nonviolence operates a Men from Burma intervention group. So in our intervention programming, which is programming for folks who are using violence, we have a Men from Burma group. The men in that group, the participants in that group, are used to dealing with a variety of people because the Center for Nonviolence is like the UN in terms of cultures and ethnicities and races and gender. And so they very quickly realize, that they have to adapt. And so they've had facilitators who are women, they've had facilitators who are Black women, they have interpreters in that group who are women. Women from Burma. And so, Diane, to your point, if you would like to use that group as an opportunity, maybe come in as a guest speaker and provide some of the
information.
What's that?
It would be my honor.
Oh, okay. Yeah, just to pass along some of the information you want to share or introduce yourself, let folks know who you are, that you are a trusted voice. and that you are someone they can trust, I'm happy to, make that connect for you.
Thank you very kindly.
Thank
You're
you.
welcome.
Rukita?
I think something that we could do is go to high schools to encourage and empower these bilingual kids to know there's a life after finish high school and go to work in a factory to get these certificates, to join in the community to work.
Yeah, we
Since
definitely,
they have
yes.
the language
We need to
already.
start, that's what I mean when I say like, we need to start investing in that community to increase the education, to increase the resources. Because a lot of times when they come over here, they literally come with nothing. And they're building from nothing. And so to come from that and to come with that history and baggage of the trauma that they've experienced, I feel like just makes that job that much more harder, but we have to be willing to take on that challenge if we're going to accept them and bring them into our country. And so starting with the youth, to work just like any youth in this country, they are our future and we have to build them up. And that's one of the things I love about what NIA does, is it's all about the youth, because what they bring, what they learn in school, what is instilled in them, what we model for them is what they are going to put out into the future for us. And that's within all of our cultures. And I think especially to your point, they need to know that there are options. We need to focus on making sure that they have the skills that they need to be successful so that we can create generational change, not only within the Burmese culture, but within all of our community, but especially the Burmese culture and any other culture that has come here and is building from scratch because they have no foundation to build from.
And then the Burmese community is blending with the community that's here. So the cultural, the relationships and the understanding is definitely needed because they're coming and blending in with the population that's here. So it's just a lot of work, and it has to start like now, and it doesn't need to be fluff. We need to deal with the real issues, and that's what we don't do. We deal with things how we want it to be instead of dealing with the issue.
And maybe that might be a starting point with this group that Elka just shared with you. That might be a good starting point.
Oh,
to have.
I'm always ready.
Yeah, to start those conversations.
Yeah, please go to all the events. I mean, every temple, churches, mosques, they provide different events. So, and you can meet a different people. I think it is great. There is a people who's got a violence, because that's another thing. Domestic violence is another huge area issue, and we all know that. So, if you can meet a religious leader, community leaders, and a different folk, a different group, then you can use to it. And usually we see it from a liaison from the city, Mr. Plamo. He usually go all around and everybody know him, so around the Burmese community, so yes.
Do we know, like, I know in the past, there's been a lot of Burmese coming from the refugee camps. Is it like what kind of rate are we seeing now? Do we know, like,
I think Catholic Charity can help those numbers, because they are, right now, if I'm not wrong, they're the only resettlement agency in here, so they would know. But less than when I started in Burmese Advocacy Center, and but now most cases are family reunification. But I think they bring it more because of what is going on in Burma right now. So,
But we don't know we really don't have I know for Bridge of Grace has a very large Asian, the population southeast has really increased in Crown Colony, being in law enforcement and doing that southeast, you just the way I travel, my eye, it's right there in front of you. You can see all of it. But the part that I really have a great concern is that we as a community is not ready for the aftermath that's coming, because we waiting. And I came in law enforcement being a preventive officer, and now we react to everything. And until we go back into prevention, we are not going to be effective.
Absolutely, yeah. It's that pendulum swinging, and I see it in
It's in everything.
Welfare, yeah, in everything. You see it go from preventative and there's great programs and you're seeing progress, and then it just like slowly.
They get rid of all the programs
away.
and then
And then it swings back.
because you have to understand crime and sickness is a business.
Yep.
I just would mention that at YWCA, we have one advocate who is Burmese. We could definitely use more, but before we had her, we had very few Burmese coming to us for assistance, and she's been flooded. There's tons and tons of people coming for domestic violence assistance. And so she is a resource, and she's helped her colleagues as well to do better at being gaining cultural familiarity and assisting people as well. I can't offer that she could come translate every client who needs a lawyer, but
Right.
she does. It's free advocacy, and so if you know somebody who needs domestic violence advocacy, we do have that to offer.
Thank you. Yeah, that's a great resource. And that's the thing, I think it's just a matter of getting the right people in the room and identifying what resources are out there and what resources do we need to continue to build. And maybe they don't exist and we need to, start working on putting those into existence.
Yeah, because the domestic violence brings sickness, the stress brings illness.
Yes.
So, we have a whole domino effect, and then when you're not doing preventive things, the domino effect, before you know it, everything has been failed all the way down.
Yeah. Any other questions? Anything on Zoom? Okay, I want to open the room up to any of our members, any upcoming events that you have going on, any announcements you want to make? Anything? Peggy, you want to talk a little bit about Thriving Thursdays?
Thriving Thursdays. I have Thriving Thursdays tomorrow, talking about stroke and its symptoms and signs. And it's at 10 o'clock here. Tomorrow, I usually have a large group of about 25 to 30 people.
Is that is it 2 Thursdays a month?
Yes, it's on the second and fourth Thursday of the month, and then they meet here, and it's only for an hour, but you can't tell them that.
Right, they're still gonna
Because
linger.
they're here till like 12:30, something like that. So you're all welcome to come, and then we have it every second and fourth Thursday, and I have new topics out there, and I can also give those to you if you are interested.
Yeah, so if you
in
have
telling young people.
any people that you have encountered through your course of work that would benefit from education related to stroke, and what was the other?
Is the stroke signs and symptoms?
Stroke signs and symptoms, that's tomorrow.
Yes, that's tomorrow.
Please feel free to send them our way, 10 o'clock tomorrow?
10 o'clock.
10 o'clock
On the
tomorrow.
nose.
All right, thank you, Peggy. Lupita, any updates on your Latino program? Anything you want to share?
Well, I have a health class on Friday, but they be calling me ahead to go with them to the intake process.
Okay.
And Mondays, I have a class where I try to teach my clients about something like adverse childhood events and how the children's be hearing the fighting or be beat up can be a fed for the rest of their life for it. So then I basically have females, 90% of my clients are females. I have maybe 2 or 3 guys that come to the classes. And I'm working like 70 hours.
Look, Lupita is a work machine, okay? That is how I met her. That is what she introduced herself as. I am a work machine. But I do want to throw out there, if you have individuals that you're working with that are Spanish speaking, that need case management, that need connections to resources, even though it's not technically necessarily what Lupita does in her role here, she is very well connected in the community. She can help find jobs, she can help them with resources and forms for getting their documents for citizenship. She is just a wealth of knowledge. So I just encourage you to reach out to her if you have individuals that are needing that assistance. I do want to throw out there that we have our health and wellness fair coming up on June 22nd. That is going to be at Fellowship Church. We are going to have many vendors there. We are planning to have music and food, and I'd like to have a little focus for the kids, maybe some face painting and clowns and fun things like that. So if you would like to have a table, if you are all ACHEC members, or if you are an ACHEC member, that is free for you to have a booth set up there. Just shoot myself or Cash an email and we will get with you to get the details on that. That will be from 11 to 2. It's a Saturday, I believe, right? Saturday.
It's July when?
June 22nd.
June 22nd, okay.
So yeah, if you wanna have a table, or if you have clients you wanna send, I believe we've sent out flyers. If not, we will do that another couple rounds, and feel free to print those and hand those out to individuals you work with, so you can come and get free resources. We'll have vaccinations. I'd like to try to get like some eye exams and a couple other screenings and preventative things that we could have going on, so.
And where's that located, I'm sorry?
It's,
On Tillman Road,
it's
25, 20, 30, or 25, 31 Tillman Road.
2531 Tillman Road, Fellowship Missionary Church. Well,
I need
Yeah.
the forms filled out, I need the survey forms filled out.
yes, survey's filled out, and Carla, you had one thing you wanted to throw out
I
there?
was just gonna share, kind of speaking to the investing in youth, and we are having a free film at Cinema Center this Saturday at 2. That's looking at racism in schools, and Dr. Diana Jackson is going to come facilitate a conversation afterwards, so.
Very nice.
That's free at Cinema Center at 2 Saturday, and then our next diversity dialogue is also focusing on investing in youth and inclusion. That's June, it's hard to remember every date, but it's a Thursday in early June, and I know we send it out through the.
Okay, yeah.
But that one's gonna include Conjure Ridley and the Peace Program. Thank you. Yes, so it'll be a really interesting and hopefully opportunity to have some of those conversations as well.
Yeah, absolutely, thank you, and we'll make sure to share that on our, on our end, on our social media, and get that out there.
And you said I think tomorrow was where?
It's Saturday
Saturday.
at the Cinema Center downtown.
Do you know where that's at? It's like, is it Berry, or is it,
Clay.
Clay? Okay. Did you have anything else? Okay. Well, thank you all for joining us today. Thank you all out in Zoom land, and those of you that are here in person, please help yourself to some snacks, chat, network, and I hope you all have a great week.